Hi, I'm Dr. Brian Baker, chiropractor and founder of the Spine, Hand, and Foot Clinic in Independence, Missouri, near Nolan Road on 39th Street. And I've been a chiropractor for 20 years, and probably the most common question or most common complaint that people come to me for is lower back pain. So today, let's start out by talking about low back pain, trying to understand it a little bit better. Many people suffer from low back pain chronically over many years with intermittent attacks of low back pain and so forth. But before we even get there, let's go back. If this is the first time you've experienced low back pain, we want to make absolutely certain that there's a mechanical cause and not some other cause that would exclude chiropractic as an appropriate modality. The first thing you want to find out is has there been a recent trauma? In other words, have you fallen? Have you been in a car accident? Do you know for sure what exactly caused the low back pain? If you do, we want to make sure that there's no fractures or dislocations. That may require x-rays or MRIs. It may require a visit to the emergency room, depending on the seriousness of it. If you're watching this video, probably, even if you've had a recent trauma, there's no reason to visit the emergency room, maybe, but if you come in, we'll evaluate that first before we actually do any treatment of you and see if there's additional information that needs to be gathered first, because we don't want to do any injury to you if an injury is already there. Okay. Second thing that might exclude you from chiropractic care is if there's some sort of disease process that is causing your low back pain. And again, if it's happened chronically and intermittently over years, there's not much likelihood of that. But if this is your first occurrence, just think about things like, have you had a recent infection? Because an infection in the skin can cause infections in the bones and cause pain in that area too. Unlikely, but possible. Cancer or other kinds of serious diseases can also reflect pain to the low back. So prostate cancer, for example, and so forth. So does it wake you up at night? Is it kind of a dull, achy pain at night that doesn't change with positions? Have you lost a lot of weight without trying to recently? Those are indications that maybe you need to be checked out by your medical doctor prior to seeing a chiropractor, because there may not be a mechanical cause to your low back pain. Okay, that aside, let's get to the 99% of people that walk in my door, which really have low back pain that has a mechanical cause. So low back pain is the symptom. The symptom is kind of the end of a cascade of events that were probably all not apparent until the pain started, and the pain is what you notice. The pain is often the thing that claims our attention. It causes us to know something's going on. Very similar and analogous to an idiot light on a car that lights up and tells you check the engine, or oil is low, oil pressure is not good. And what it does is it indicates to you that there's a problem. The problem is not the flashing light. The problem is what the flashing light is trying to communicate to you. Same thing with your body. The pain is not natural. A natural state is to be healthy and painless. So when there is pain, I view it as an indication of your body that something is not right. So if we want to fix it, although medication might make the pain go away and that might satisfy you for some period of time, it might also be avoiding recognizing the underlying cause and therefore allowing that cascade of cause to do more damage on the inside that will cause you greater problem later on in life. So we do want to get rid of your pain, but we don't want to mask your pain and allow an underlying degenerative or wearing out process to create more damage in your body. Just like what would happen in a car. I mean, if your oil light is on, you could cover it up. You could avoid seeing it and therefore not be irritated by it. But if it's trying to tell you the oil is low and you keep driving it, you're more likely to cause more damage to that car over time by not paying attention to what the light is saying. Common sense, right?